All right, Chapter 9, Exercise, Diet, and Weight Control. So what is the optimal body weight? Going back to Chapter 6, we talked about the optimal body fat percentages. Remember, we go by that, never go by BMI. For adult men, 8 to 19%. For adult women, 21 to 32%. Young adult men was 12 to 15%, and then young adult women was 21 to 25%. So if we were in class, first question would be name 3 things that can have an influence on a person's weight. The main 3 that come to my mind are genetics, your diet, and also the exercise that you do on a daily basis. So factors affecting weight management, your genetics and your hormones. Unfortunately, these things are what they are. There's nothing you can do to change them. Your appetite control center is located in your hypothalamus, and that is located in your brain. So this is in charge of monitoring your fat and your sugar levels in your blood and your hormone receptors. Physiological, it's your release of hormones, and there's 2 main ones when it comes to your appetite. Leptin is responsible for regulating energy intake and expenditure, and it is going to depress your appetite. So as you're taking in food, your brain is basically monitoring it, and when you get enough, leptin is released. Ghrelin, on the other hand, that's your meal initiation. So once you start to feel hungry, this is the hormone that's released. So that's the one that's going to tell you to go and eat. Environmental factors, your eating habits, your diet, and your exercise. These are all things that you can control yourself, so they need to remain the primary focus. You've got 2 different types of energy balance. You've got resting metabolic rate, and then you've got exercise metabolic rate. Your resting metabolic rate is the amount of energy expended while sedentary. So while you're sitting in class, or while you're watching lectures on the computer now, or while you're sleeping in bed. Your resting metabolic rate is influenced by your age, and unfortunately for us, it decreases with age. Also, it is influenced by your gender. The amount of lean body mass an individual possesses, which is your muscle, the more muscle you have, the higher your resting metabolic rate is. Your exercise metabolic rate, on the other hand, is the amount of energy expended during exercise, and that is the key factor in weight control programs. All right, you've got 3 calories in versus calories out scenarios. So weight gain is when calories consumed is greater than calories expended. Weight loss is when calories consumed is less than calories expended. And then weight maintenance is when calories consumed is equal to calories expended. Unfortunately, that is not always the case. What plays into it as well is the type of foods that are consumed. So if you're taking in, 1,500 calorie diet and all you're doing is eating carbs such as donuts and cookies and muffins and things like that, that's going to not be the same type of food as if you were taking in, like lean meats, fruits, and vegetables. It's going to affect your body differently. All right, looking at this chart, as you can see, different types of activities are going to help you burn off calories in a different rate. So bowling is 3.2 calories per minute. Tennis singles is 7 calories per minute. Running at an 8-minute per mile is 12.6. So as you increase the intensity of the activity, also you will increase the amount of calories that you burn while doing it. All right, so designing a weight loss program, some people have very unrealistic goals when it comes to weight loss. They might say, hey, look, I need to lose 25 pounds in a month. Well, unfortunately, that is usually not realistic, nor is it healthy for you. What you really want to focus on is losing about 1 to 2 pounds per week. That may not seem like a lot, but that's healthy for you. That is done by cutting 3,500 calories out of your diet each week. So remember, you want to aim for the middle of your optimal body fat percent range. You want to use short-term and long-term SMART goals. And then also keep a record of your progress. Any progress is progress. So if you lose 1 pound a week and then the next week you lose 2, you're still making progress towards your goals. Assess and modify your diet. in that food log project, you are keeping a food diary. Sometimes people don't even realize what they're consuming throughout a day until they start to write it down. So you want to follow sensible dietary guidelines, no extreme or fad diets. But what a fad diet is basically it is a diet that is going to promise unrealistic or unfounded results. You also want to aim for lifelong change. When you think about New Year's resolutions, a lot of times those people fail because they don't want to do anything to change their lifestyle. They just want, short-term results or quick turnaround results. Unfortunately, when you're looking at losing weight, you need to really focus on making those healthy choices and changing into those healthy habits. And then once you reach that goal, you need to do things in order to maintain that. All right, so here's another participation question. Name 3 things that someone may do in order to lose weight. They might cut sweets, they may exercise, they may, skip meals. There's lots of unhealthy ways to lose weight, and then there's also healthy ways to lose weight. And what we need to do is focus on the ones that are healthy for us. All right, so weight loss program design. Plan your physical activities. You need cardio. Cardiorespiratory exercise assists fat burning. So moderate intensity exercise, 50 to 70% of that VO2 max is going to be the optimal area where you're going to see fat burning happen. Now, going back to that 3,500 calories, that may seem like a lot, but this is the weight loss equation. So you burn 250 calories through exercise, and then you decrease your caloric intake by 250 calories per day. You could do that simply by maybe eliminating a snack, avoiding that candy bar, avoiding that slice of pizza. 250 calories both ways, that's 500. You do that every day of the week, so that would be 7. So 500 times 7, that's your 3,500 calories. That's the way that you're going to lose that 1 to 2 pounds each week. Also, for your weight loss program, you also want to increase or include that resistance, that strength training. Some people want to avoid that because they're afraid that they're going to put on weight if they're putting on muscle. But you need to remember that the more muscle that you have, the quicker your resting metabolic rate is going to be, so it's going to burn calories when you're not really doing anything. So also you want to include both high and low intensity exercises to promote your overall weight loss. So focus on behavior modification. Weight loss and management are not short-term events. So when people set unrealistic goals like, losing that 25 pounds in a month, that is so unrealistic. You want to make sure that you're setting those short-term events so you can still maintain your progress. Develop healthy low-calorie eating habits. Avoid social settings where you might overeat. When you go to parties, when you go to your family events, especially on the holidays, this is extremely hard to do. Some of those foods you only get to eat one time a year, and you want to take advantage of them. Just try to do your best. If you know you're going to go to an evening where there's going to be, lots of food to snack from, maybe eat a little bit before, so then you won't be as hungry or as tempted. Exercise every day or at least 3 times a week, that 30 to 60 minutes. Reward yourself with non-food rewards. So maybe if your goal is to lose weight and you are, then your clothes may not fit right, so then you have to go shopping. Maybe it's something as far as, going to a trip or going to a museum, getting your nails done, buying shoes, whatever it is that's going to keep you thinking positive and wanting to continue your goals. Think positively, avoid those fad diets, and prepare for occasional setbacks. They're going to happen. No matter what the goal is, occasional setbacks are going to happen. It's just part of the bumps in the road. And then lastly, get support from your family and friends. When they know that you're trying to do something, they are there to encourage you and hopefully not deter you or try to persuade you to do things against those goals. All right, so normally at this time I'd break you into groups and talk about different fad diets that there are. Some of these you may have seen of, some of them you may not have. You can go ahead and look those up and see what they're all about if you're interested. Some of you may have heard of the paleo diet, that is known also as the caveman diet. Basically, it's just eating anything that you can hunt and gather. Fresh fruits, fresh vegetables, lean meats, things like that. The worst one of this is the cabbage soup diet, where basically you eat cabbage soup for 5 days and then you put in different types of foods with it. Very short term, very bad for you because it also can cause severe dehydration. All right, so when you look at people's diets, some of them don't want to lose weight, but some of them want to gain weight. And what I mean by that is gain good weight, and that would be in muscle. So people want to increase their muscle mass rather than fat mass. So if you look down at the picture, 5 pounds of muscle looks a lot better than 5 pounds of fat. So of course, in order to gain muscle, you're going to have to include weight training. You want to combine exercise with proper nutrition. So when you are trying to gain muscle, you do need to increase that protein, and you also need to increase that water intake so it can be synthesized down. You want to create a positive energy balance, so you need to take in more calories than you expend when you're trying to gain weight. But those need to be good calories, not empty calories. So weight training's energy and caloric expenditures, approximately 2,500 calories are needed to synthesize 1 pound of muscle. 400 of those calories must be from protein. So about 1/4 pound of muscle can be gained per week if you follow a good diet and rigorous strength training. All right, some people are not able to lose weight, and their health can definitely be in danger because of that. So some extreme measures for weight loss, some extremely obese people may need more than just behavioral changes to lose weight. So there's 2 different types. All right, you got surgery. There's 2 different ones. You got restrictive procedures, and then you got malabsorptive procedures. So with the restrictive procedures, some of you may have heard of the gastric band or the lap band. With any type of surgery, there's always risks. You could have risk of infection. You could have risk of your body trying to rid itself of the foreign object that's in it. With the lap band, it is kind of held together by a balloon, and that can deflate, which could cause slippage of that. So it could go up onto your esophagus, or it could go down further around your stomach. If that occurs, then you will require another surgery. Malabsorptive procedures, most of your absorption of your nutrients is done in your small intestine. So with this type of surgery, basically they take some of your small intestine and they bypass it. So you cannot absorb as much as a normal person would without this type of procedure. So surgery is considered as a last resort only for serious cases. The other extreme is medications. And unfortunately, the long-term safety and effectiveness have not been established. Some things that have been reported as that, people take these appetite suppressants and they do really good and they lose a bunch of weight. And then once they get off of them, all of a sudden that weight is starting to come back. All right, so disordered eating, unfortunately, especially here in the United States, a lot of people, have social pressure to be thin, and that can often lead to unhealthy or dangerous eating behaviors. So what group do you think is the primary ones that have that social pressure? Most common group is those adolescents and the young adults. We're still trying to figure out, who they are and how to be happy in their own skin. When you look at magazines, when you're looking at, people in those, what people don't often realize at that age is that those pictures are often photoshopped. So, that woman or that guy with the perfect body may not actually have that perfect body. It could have been fixed by the computer through a program. All right, so the first eating disorder we're going to talk about is anorexia nervosa. What this involves is severely limiting calorie intake to the point of starvation. It does occur in both men and women. However, the highest rate is among adolescent girls. So when somebody is suffering from anorexia, they may try to go the whole entire day without eating. Or if they do eat, they might, try to rid your body of those calories through excessive exercise or even to the point of using laxatives. Bulimia nervosa is cycles of binging and purging, frequent vomiting. When you are vomiting so much, that acid from your stomach has to go somewhere. So when you're vomiting that often, it can do damage to the esophagus, to your teeth, as well as to your stomach. With bulimia, sufferers may have that normal weight look or that normal look. So this one is very hard to tell unless you are seeing that repetitive cycle of that purging. Binge eating disorder is just binging without purging. It's compulsive eating, and often sufferers will actually gain weight rather than lose weight. All right, so some eating disorder statistics. Eating disorders affect up to 30 million Americans. This has increased by almost 6 million since 2016. 1 in 5 women struggle with an eating disorder or disordered eating. 90% of those who have eating disorders are women between the ages of 12 and 25. An estimated 10 to 15% of people with anorexia or bulimia are male. And then eating disorders have the highest mortality rate of any mental illness. And eating disorders are classified as having a mental illness. The National Eating Disorder Association hotline, so if you yourself are suffering from one of these eating disorders or know somebody that is, the hotline is there and you can find good resources not only for yourself but also for those around you. All right, so your restaurant assignment, that's the one that you're already hopefully working on. That's the one that is due Monday by 9 p.m. You need to upload that to Canvas. All right, so your questions. So you would first match these two up. Leptin and ghrelin, which one is the one that's going to tell you to stop eating? And that is A. And then ghrelin is B, which tells you to go and eat. All right, which of the following is not an environmental factor for weight management? So what do you not control? So the one of these that you do not control are your hormones. So that would be the answer. All right, so matching up these three, weight maintenance and weight gain and weight loss, the three scenarios. So weight loss is when calories is less than calories out. Weight gain is when calories in is greater than calories out. And then weight maintenance is when they are equal to each other. So the correct order would C, B, and A. All right, so in regards to the optimal weight loss equation, how many calories should be cut from your diet each week? So remember, we're going to cut 250 from your diet, and then we're going to burn off 250, so that's 500 times 7. So the answer is going to be 3,500 calories, and that's how many you need to cut, once again, to lose that 1 to 2 pounds each week. All right, so which of the following is not an eating disorder we discussed today? So you got bulimia nervosa, anorexia nervosa, binge eating disorder, and then fad diet disorder. So of course, the one that is not recognized as an eating disorder is D. All right, so in order to get your participation points for this lecture, you need to email me your responses. Remember, if you want to do those extra credit questions, those are going to be due on Wednesday. Since we're not going to have class, we're going to just make the extra credit questions just the following week, like our following class period, like we would. check your email, make sure that you are up to date on any schedule changes because they are going to occur. I'm going to try and do this week by week, and we're going to see where we stand after the first initial online break, if you will, which is supposed to end April 3rd. So make sure you're watching your email, and make sure you email me your participation answers for those questions. That way I can get those points for you. Thank you. Have a good day.